Good afternoon, everyone. I'm Kayode Fowode, Vice President of IOSH, the Institution of Occupational Safety and Health, the world's largest professional body for health and safety, and for those who work to protect and enhance the safety, health, and well-being of people employed across sectors everywhere. I'm delighted to be your host today, and I'd like to thank you all for joining us. This is the first collaborative webinar IOSH has hosted in Nigeria in partnership with the World Health Organization, Lagos State Safety Commission, Chartered Institute of Personnel Management of Nigeria, and the Federal Road Safety Corps on managing the COVID-19 pandemic in the region. I'd now like to introduce you to our present presenters and the topics they are covering. Firstly, IOSH Chief Executive, Bev Messenger, will give an overview of International Workers' Memorial Day and the World Day for Safety and Health at Work, which both take place today, and will provide information about the institution. Dr. Ivan Ivanov, Occupational Health Team Leader at the World Health Organization, will provide the latest updates around COVID-19 crisis. Also, Busola Alofe, Chief Executive Officer at the Chartered Institute of Personnel Management of Nigeria, will share insights on how HR professional is now focusing on health and well-being at work and home during the pandemic. Larry Mojola, Director General at the Lagos State Safety Commission, will also provide guidance on work and life after the lockdown restrictions are over. We'll also have Dr. B.O. Oyeyemi, Corp Marshal at the Federal Road Safety Commission, Corp. We'll talk about traveling safety during this challenging time. So we want to support you with this platform to provide a two-way channel, giving you the opportunity to share support and guidance on this evolving issue, whichever industry you are in. We have a member of the IOSH team who is taking care of the technical aspect today to help run this session as smoothly as possible. Please ensure all your mics are on mute. On your screen, at the top left side, you will notice a small bar with some written options on them, which are your chats and Q&A, your question and answer. If you have any technical issues or radio problems and need to message us at any point, please use the chat option. And also, if you have any questions for the presenters relating to the content of the session, please post them using your question and answer option, which is your Q&A option. Also, at the end of the presentation, we will then run through the questions you posted throughout the session. Finally, just so that you are aware, this session is being recorded for future playback. I'll now like to welcome Bev Messenger, Chief Executive of IOSH. Bev, could you please share your screen, please?
I'm delighted to join this webinar to support tackling the COVID-19 pandemic in Nigeria. And I'd like to thank each and every one of you for joining us today on International Workers' Memorial Day and World Day for Safety and Health at Work, two very significant dates in the occupational safety and health calendar. IOSH is proud to support these two important days. This year, both initiatives are focusing on tackling the spread of COVID-19 pandemic, which unites us all as a global OSH community. International Workers' Memorial Day is organised by the UK's Trade Union Congress. The day remembers all of those who have tragically lost their lives at work. And of course, this year, this includes all those who have sadly left us as a result of the coronavirus. World Day for Safety and Health at Work is organised by the ILO, the International Labour Organization, and is designed to raise awareness of occupational safety and health practices to keep workers safe. IOSH is supporting both initiatives in many ways, remembering the dedicated workers who have tragically lost their lives during our 1 minute silence this morning, as well as contributing to webinars such as this, and the ILO's webinar, Stop the Pandemic, Safety and Health at Work Can Save Lives, where OSH experts will present on a range of topics, including the health and safety response to the pandemic, the impact on mental health of workers, and how to prepare for return to work under a risk-controlled scenario. Please do support these important initiatives and join the conversation today on social media using the hashtags #IWMD20 and #World Day for Safety and Health at Work. For those of you unfamiliar with the work of IOSH, I'd like to share some background information. We have 48,000 IOSH members worldwide who contribute to our networks, our branches and groups. Many pursue their professional development in alignment with IOSH's competency framework and the training, skills, mentoring, volunteering and collaboration opportunities we provide. Right now, many are hard at work supporting their colleagues, leadership teams and suppliers as they adapt to the new health protection needs during the current pandemic crisis. IOSH has 4 distinct but connected roles. We represent the occupational safety and health profession globally. We are a charity without geographic borders. Our not-for-profit status and our Royal Charter offers benefits globally. Our funds are directed towards public good and we ensure that we invest them wisely to provide maximum impact and benefit to the OSH profession and the world at work, whilst our strong corporate governance ensures the quality and integrity of our work. Our status within the profession means that many individuals choose to support us by becoming members. We are the largest OSH membership organisation, which collectively creates a fantastic asset that allows us to operate in over 130 countries. Our role as a thought leader generates trust and respect. All of our policy positions, advice and guidance benefit from our global membership and are underpinned by our own OSH experts and research and evidence. And finally, we're an enabler of organisational success worldwide. As a vocational body, our members, our products and services support business and public bodies and their supply chains worldwide to achieve their strategic goals responsibly. During times of major crisis and challenge, such as COVID-19, professionals responsible for occupational safety and health hold vital roles, helping organisations and governments to protect lives and manage risks. They support business continuity and ensure organisational resilience and sustainability. They work in all sectors and for all organisations of all shapes and sizes across the globe, and IOSH is actively supporting all of these efforts. Workplaces everywhere can be effective focal points for guidance on preventing the spread of infectious diseases like COVID-19. IOSH provides access to key information and webinars on pandemic-related OSH and wellbeing and preventing virus exposure at work, coordinating with many other leading international agencies. We are pleased to support this vital work by sharing resources with OSH professionals, employers and other stakeholders by collaborating with key partners in Nigeria. Please do take a look at our website for more details and free resources. I do hope you find the rest of the webinar informative. Thank you.
Thank you, Bev. If I can hand over to Dr. Ivan Ivanov from WHO. Dr. Ivanov, please share your screen, please.
Good afternoon, everybody. Good morning and good evening if you are in other parts of the world. My name is Ivan Ivanov and I'm the team leader for occupational and workplace health in the headquarters of the World Health Organization. And currently I'm dealing with the protection of workers, including health workers in the COVID-19 response, the WHO actions on COVID-19 response. And on this day of World Day for Safety and Health at Work, I'm very pleased to join our friends in the Institution of Occupational Safety and Health in this webinar for Africa and Nigeria. The IOSH has been a partner of WHO and has supported a lot WHO in fighting this virus and in fighting this epidemic and in raising awareness in the world of work, in particular among occupational safety and health professionals about what they can do in order to help fight this pandemic. So today I want to bring to your attention specifically the issues around health workers and how the COVID-19 is affecting health workers, because we are extremely concerned about this. As of 21st of April, countries reported that over 35,000 health workers were infected with COVID-19. And this number is probably much higher because some countries do not report separately health workers from the general population. And we're concerned about this for two reasons. First is that people are suffering, people get sick. But second, health workers, when they get infected, either at work or at the community, they go on sick leave, they go on quarantine, and they cannot fulfill their duties. And this is depleting the most essential resource for the fighting of the outbreak, and this is the health workforce. And in many countries, in addition, particularly in Africa, we also have a shortage of health workers. There are a lot of occupational risks for infection among health workers, including contact with patients with unknown COVID status, working long hours, suboptimal adherence to infection prevention and control. And therefore, WHO recommends that actions in health facilities on infection and prevention and control should go hand in hand with occupational safety and health interventions and a combination of environmental and administrative controls. It is not reliable to rely only on personal protective equipment. All of you who are occupational safety and health professionals, you know that personal protective equipment is the least effective action, the least effective intervention in the hierarchy of interventions. The same is also for the infectious hazards. Next slide, please. All right, this is some a slideshow from our African office showing how health workers can stay healthy. And the measures are very simple: hand hygiene, respiratory hygiene, wearing personal protective equipment, reporting immediately if they have symptoms, but also what not to do. Do not touch a patient without without washing hands. Do not touch eyes, nose, and mouth. Do take make contact with if there are symptoms, have a contact with the health provider, and certainly do not have contact with patients without wearing personal protective equipment. Next slide, please. We are extremely concerned about the increasing rate of violence and stigma against health workers. In general, between 8 and 38% of health workers suffer from physical violence at some point of their career. But when there is a crisis like this violence, physical, psychological, even sexual harassment are increasing. And we also witness attacks against healthcare facilities. Even in Africa, some healthcare facilities, isolation centers that were prepared for COVID cases, isolation, they have been destroyed by local communities. Doctors, nurses, security personnel, all those who are assisting in the response to COVID, they also experience threats and aggression. Therefore, WHO calls upon governments, employers, and workers' organizations to take measures and to institute policies for zero tolerance to violence against health workers at the workplace. And this is extremely effective. For example, recently, the Indian government has issued a special law that makes criminal any attack against health workers or against health facilities, makes this into a criminal law. Similar law in China, similar laws in other countries were issued. Next slide, please. We are also very concerned about the long working hours and the psychosocial hazards among health workers. In a crisis like this, many health workers have to work longer or irregular hours because there is enormous demand, and particularly when there is a shortage of health workers. But also fatigue, occupational burnout is related to medical errors and poor quality of care. So this, in addition to the suffering of the health workers, is also jeopardizing patient safety and the quality of care. We also face situations where health workers are subject to stigma, some of them even evicted from their homes because the local community is afraid that they may carry disease. And certainly all this affects the health, the physical and the mental health of health workers. Therefore, WHO calls for adequate staffing levels, safe staffing levels in all health facilities, and a clinical rotations as measures to minimize psychosocial hazards, and also provision of access to mental health and psychosocial support for health workers who are suffering. Next slide, please. And on this day, our Director General, Dr. Tedros, he's African, as you all know, he comes from Ethiopia, and he called for action. He said the COVID-19 pandemic has highlighted the urgent need for strong national programs to protect the health and safety of health workers, medical professionals, emergency responders, and the many other workers risking their lives on our behalf. On the World Day for Safety and Health at Work, I call on all countries to assure well-defined, decent, and safe working conditions for all. Next one, please. And here you have some sources where you can find a lot of information about all WHO recommendations for health sector, but also for other sectors that we have issued for COVID-19 response. And also there is a special WhatsApp line that is open for questions and answers to WHO that I highly urge you to use. Thank you very much for your attention. Over.
Thank you, Harman, for your presentation. We will now hear from the CEO of Chartered Institute of Personnel Management of Nigeria, Busola Alofe. Busola, please share your screen.
Okay. Good afternoon all, and thanks very much for this opportunity to be partnering with IOSH, the World Health Organization, the Lagos State Safety Commission, and the Federal Road Safety Commission to share a few thoughts around managing the pandemic and supporting the health and safety of workers now and post-lockdown. Today, the World Day for Safety and Health at Work 2020. First of all, I really want to say a big thank you to the health and safety workers, essential services workers everywhere all over the world who are putting themselves right at the forefront of this pandemic and protecting those of us at home and elsewhere from the onslaught. They are giving their lives, they're giving their time, they're giving their energy, their hearts, their souls. We are very grateful. And to our governments, you know, the leaders in different organizations who are relentlessly looking for cures, looking for solutions, we say a very big thank you today. World Safety Day, today, the World Day for Safety and Health at Work aims to stimulate national tripartite dialogue on safety and health at work. And you know, the ILO is right in the forefront of it, the United Nations, and all of us. And particularly the ILO is using this day to raise awareness on the adoption of safe practices in workplaces and the role that occupational safety and health services play. It will also focus on integrating measures into IOSH management systems and policies at the national and enterprise levels. That is particularly important to all of us on this webinar today. And HR practitioners, there's a lot of work we yet can do in terms of really strengthening occupational safety and health practices at work. I will speak a little, giving a background, and then move into keeping workers safe now and post-lockdown, and I will end with a conclusion. So we are all familiar with a lot of these images. It is a time of extraordinary disruption and anxiety. COVID-19 is a humongous humanitarian challenge, as we all know, that covers the entire globe. When I started this job on January the 2nd, 2020, as the CEO of the Chartered Institute of Personnel Management, little did I know that this is what I will be doing today. And I know that that is the reality of practically everyone. Never heard of COVID, and hadn't even heard the term social distancing. And then, talking about, stopping the spread. We must not get to the peak. All of these are our realities today. The social distancing measures introduced, washing of hands, sneezing into elbows, stay 2 meters apart, fumigating, disinfecting, and you can see empty roads everywhere once the lockdown started. And, in Nigeria, for example, and it's the same everywhere, every day we get the results, the data of confirmed cases, discharged cases, deaths. So the global stats, 3 million cases, more than 200,000 deaths all over the world. But the good news also, and I think it's really important for all of us to remember that there are bright spots in what is going on. There have been more than 900,000 recoveries, which is a 30% rate of recoveries on confirmed cases. That is something worth smiling for, no matter how gloom the horizon looks. In Nigeria, we have 1,337 cases, we have 40 deaths, but also 255 recoveries as of last night, representing 19% recoveries, which is also good. A lot of health and safety precautions I mentioned, lockdowns, stay at home, work from home, with a lot of impact on global industries. This week, we've seen oil and gas downturn like never before. May futures trading at below $0, which means, you can take my oil for free. I don't want it, particularly because there's a supply glut. No one is taking oil right now. And as we know, oil is what moves the world around. So thinking about that, it's really challenging times. But again, on the positive side of that, look at air pollution. Everyone's at home, or most people are at home. Transportation, grounded. Air pollution has reduced significantly by 40 to 60% in different places across the world. And that is worth kind of taking a second look at. Businesses sadly shutting down or collapsing, the small and medium scale enterprises really hard hit, a lot of layoffs, people losing their jobs, losing their pay. There's social unrest in many countries with a lot of economic crime on the rise, primarily because people are hungry. And as we know, a hungry man, woman, child, they can become really, really angry. Individuals, I've talked about the hunger, anxiety, and restlessness. Governments, businesses, everyone is putting in place all sorts of palliative measures. But this week as well, we are seeing increasingly a lot of unrest and agitation to reopen. That brings along with it quite a number of anxieties. And all of this is taking a toll on life, on minds, on bodies, and on spirits. We've moved to life on remote. Shopping is done remotely. Playing is done remotely. Sports, concerts, praying even is done remotely. We've seen weddings done remotely, funerals done remotely, and worship done remotely, showing that data and technology are king. And both now and post-lockdown, if we want to get ahead of this thing and be 10 steps ahead, it's very important that we embrace data, we embrace technology, and we sniff out the opportunities that this pandemic is bringing our way. So talking about workers and keeping workers safe, both now and post-lockdown, more than ever before, the definition of the workplace has shifted. Okay, it's any and every single safe space where the worker can get an online connection to do their work. A lot of mindsets need to really shift. I think a lot have shifted because we woke up and we all had to stay at home, at the same time get work going. So suddenly all the kind of blockers to remote working shifted by miles, and suddenly businesses find that it is actually possible, probably very beneficial, and there are pros and cons of it. Everyone is forced to explore it. For the worker, for employees and employers, it's important to emphasize that employee and employer rights and obligations are center stage. And as HR professionals, we've got to take this very, very seriously, because wrong moves and wrong actions at the wrong time without the right legal support may lead us to take our organizations into serious litigation. So there's a lot of need for us to be on top of business continuity plans and risk management, employment contracts. The work arrangements are changing and will continue to change. We'll have to look into workforce optimization, of course, policies, pay and benefits, engagement, because there are a number of legal actions that we might have to take or must take, however, dependent and subject to getting the buy-in and support of unions, for example, and the community of workers generally. Tools and equipment are having to change. We're having to pay a lot of attention to health and wellness. And this is an opportune time to really encourage health and HR professionals to pay attention to occupational health and safety in the workplace. I see that as a big opportunity area from my work at the CIPM and with all the organizations and members that we have to really start to understand occupational health and safety more than before, to build our knowledge, our skills, our competencies, to really do everything to keep the workplace, the workers, and the way work is performed safe. So security, safety, and all other support we provide are very important. Going into the post-lockdown period, and these are things that are already happening, it's critical for governments, for business leaders, for individuals to think holistically about policies and actions that will cover the national economy. We see that in our different countries. Revenues are on the decline. We need to stem the bleeding. However, we must retain empathy and focus because it's also a people crisis globally. We must improve our healthcare systems, security and safety, and jobs. The physical environment, we've got to think about mobility. So a lot of people are agitating for return to work. Well, how about mobility, transportation in the workspace itself? And importantly, the workspace, as I said earlier, is wherever work can get done. It's not necessarily in a particular physical place or space. So HR professionals will need to have a broader view of what constitutes the workspace and all the things that must be done to protect workers in those different and varied workspaces. Technology and tools play a very great part with that. And for individuals, people, we must think about them holistically as well. The mind, the body, the spirit. For the mind, engagement, mental health, the work and the pay. People get anxieties when they don't know where the next paycheck is coming from because we all have obligations, we have to live. So it's important also to assuage people's minds and help them to see how the organization is going to help them, how the government is going to help them, and how they need to help themselves. Body, the precautions, the safety precautions about social distancing, regular washing of hands, and all that, it's important that we keep those up. When Ebola happened a few years ago, we did all of those things, but the minute Ebola disappeared, we stopped. These are really good things to continue to do, and I really think it's important that we retain focus on those. Personal protection equipment, not just for health workers, very important for them and emergency workers, but also every other worker in the office. So masks, now every government is kind of advocating nose masks, face masks. We've got to make sure those are available and people have to know how to use them. So there's a lot of communication there. Yesterday, I was sharing a concern around these face masks. I mean, if a face mask, the ones that we make at home, is made with the same material on the inside as on the outside, well, if someone puts it down and then puts it back on, do they know not to put on the side that was exposed to the coronavirus before? Do they know? And so, you know, do we state that face masks should actually have two different colored sides, and maybe a plain black one is always on the inside? So it's easier for people to know that you never put the colored side to your nose and your mouth. That should always be on the outside, while the plain colored side, the black side, is the one that should always cover your nose. Little things, the devil is in the details. So precautions, PPE, food, there has to be food on people's tables. Some of the palliative measures we're seeing is governments trying to get food and essential items to people, relaxing lockdowns for periods of time so people can go out to purchase essential items. And also when we're at home, it's important that we get exercise, that the blood keeps flowing. HR professionals, post-COVID, these are things that we are going to have to think about. And of course, spirit. Communal solitude as we are in lockdown and connections will become increasingly important even as lockdowns are relaxed. The New Zealand story, which is breaking as we speak, is really an interesting one. They are reopening. They say the virus has been eliminated in their country. And they've done a lot of very, very interesting things and have a lot of interesting actions that they are introducing as they reopen their economy. I want to also encourage everyone to follow that story online and on the media and take ideas and suggestions from what they've done in New Zealand. With regards to addressing reopening, important to think about resumption and compliance. Would all workers really feel safe to return to work from day one? So in Nigeria, our government is relaxing lockdown protocols with effect Monday. From Monday, where it's all being open, is every worker going to be free, feel free and safe enough to go back to work? Will employers start to force people to go back to the physical office space? What are we going to do? In the home, the personal support, our schools opening at the same time because a lot of people have children at home. If they're going to go back to work, who's taking care of the kids, family issues, the important point around safety mobility, safe mobility rather, transportation, making sure people get to and from work daily, safely. Public transportation, who is going to do the disinfecting? How are we going to maintain social distancing if 50% of a bus is going to be occupied? What's going to happen to rush hour traffic, rush hour masses? And every day, how do people go to work and get back home in the midst of this anxiety about getting an infection potentially? So all these affect the mental health and well-being of our workers, both now and as we relax lockdown. So it's important for HR professionals to provide ongoing support and focus on having employee assistance programs in the workplace. There's this very interesting article by McKinsey that has compiled about 75 interventions from across the world for workforce protection during the return to work. And they've looked at actions from different countries, what different organizations have done, that covers 5 phases of the workforce journey. It is a journey from pre-release to even post. 8 levers of protection in detail and looking at different environments, the office, the retail space, field, and manufacturing. I'll share just a little about this as I wind up. We need to think about pre-entry actions. They must be in place. How people drive safely, the behavior norms, very important. The use of protective equipment, testing and isolation, taking temperature checks, increasing awareness, cleanliness, disinfecting office spaces before we actually open up, and upgrading equipment. So that's all pre-entry things that we must think about. And then, you know, all these individual actions that have to cover how people travel to work, increasing the safety protocols, using private transport as much as possible, staggering the entry, maybe moving to more shifts, essential jobs being identified, not quite essential jobs being allowed to continue to work from home, limiting on-site capacity, separate hours for vulnerable populations. Of course, I've talked about mental health awareness programs and contracting mental health services, encouraging and mandating PPE care, and so on and so forth. And then while people are at work, there's so much that we need to do. You will get these slides, so I'm not going to go through all the actions here, but there's a lot that we must have our fingers on and take action about as we reopen. Common spaces, eliminate them or limit the numbers of people that can be there in order to ensure we maintain social distancing. A lot of communication, engagement is very, very important. And how about thinking about, so what do we do if anyone at work gets infected? We've got to think through this from the point at which we identify someone that has been infected, through to contact tracing, through to making sure we address the medical situation of that person and anyone else that has been exposed, 14-day quarantine periods, and then, you know, treatment and how all of this goes back into supporting employees at work. These are all very critical. So at the CIPM, I see this as very important in terms of leadership. To be leaders, we must focus on ourselves as individuals, leading self, fixing our confidence, dealing with self-awareness, We must understand and commit to life goals personally. We must be people with integrity, which means, you know, if anyone contracts the virus, we need to speak up. Being humane is fundamental to what's going on and how we will win in the long term. We've got to put people at the center of this, even more than ever before. Dealing with setbacks, flexibility and adaptability. This is all about being agile, seeing things from a new perspective, dealing with ambiguity. Oh my goodness, there are so many dilemmas that we are dealing with right now. Again, leading others. So we will have to really think through all I've spoken about with regards to reopening in terms of managing and motivating team members, subordinates, developing them. So people have been doing a lot of learning and development virtually this period of working from home and the lockdown. After that, it has to continue. Because there's so many benefits of that. I'm seeing so much collaboration across organizational boundaries, globally and in country, across countries, and even across organizations. That needs to continue. We'll have to manage teams, manage project teams, cultural savvy, relationships across the board, credibility, communication and feedback, gaining influence, managing multiple stakeholders. All of these are absolutely critical. And it leads me to remember the trust equation. Reducing self-orientation, focusing on everybody else, fundamental to success going forward. And of course, leading the business. So execution, creativity, entrepreneurship, improving functional knowledge, of course, gathering information, knowledge, and insights. I said earlier, data and technology are very, very important. But we must be decisive and we must focus on solving problems, broad organizational perspectives and strategic insights. More than ever before, HR professionals, we are being called to be OD specialists, and we've got to make an impact on the business and also be able to effectively handle organizational and cultural change. So it's all about addressing the fear, strengthening resilience, and really leaning on empathy, seeing with the eyes of another, listening with the ears of another, and feeling with the heart of the other. Very, very important. It's all about the other person. So thank you very much, everyone. Do stay safe.
Thank you, Busola. Thank you, Busola, for your presentation. We'll now hear from the DG Lagos State Safety Commission, Mr. Larry Mojola. Please, could you please share your screen, please?
Good afternoon, everyone. Thanks, Kaide. Good afternoon to all participants on this webinar titled COVID-19 in Nigeria, Managing the Pandemic and Supporting the Health and Safety of Workers Now and Post-Lockdown in celebration of the World Day for Safety. It gives me great pleasure to speak today on guidance, particularly focused on workplace safety post-COVID-19 in Lagos State, Nigeria. Again, massive thanks to everyone that has made this possible today. Special thanks to IOSH, to the WHO, CIPM, and the FRSC. I'd also like to thank the last two speakers for their brilliant presentations. The world we know yesterday has changed for at least for a very long time to come. And the new reality is the fact that we need to refresh and relearn as we now go into the future. Being comfortable with discomfort might be the new way forward. And as such, we need to be well prepared. I'll be discussing some of the new requirements the government as a whole is taking with regards to workplace safety. And I'll talk more in detail in the course of this presentation. However, for us to ride this storm, I personally think there are three things we need to note. We need to reinvent. Not necessarily reinventing the wheel, but we need to question how we currently work. We need to see how we can be more effective and efficient. In the words of Peter Drucker, he says, efficiency is doing things right, and effectiveness is doing the right thing. Secondly, we need to collaborate more. The last speaker spoke a lot about collaboration. The world indeed has become a much smaller place. The virus that started probably November, December of last year has now spread to over 210 countries and territories around the world, infecting over 3 million people. Thousands of scientists are collaborating on finding a cure as quickly as possible. this virus has brought people of different nationalities together. As occupational safety and health professionals, we need to jump on this momentum and collaborate even more with others to find lasting solutions to injuries, diseases, and fatalities at the workplace. Thirdly, we need to have a change of mindset. We need to let go of how we did things in the past and open up new ways of work in the future. Not doing anything will make us irrelevant. No better time than now, presenting the bigger opportunity for occupational safety and health professionals. We need to have a sense of urgency about this. My presentation will focus on the new normal within the workplace. But before I start, I'd like to talk a little bit about Lagos State Safety Commission and what we've been doing. The Commission is the regulatory agency of Lagos State government, invested with powers to formulate policies, approve codes of practice, guidance, notes, enforce regulations on all matters concerning safety of lives and properties across the state. We're also engaged in all spheres of socio-economic activities, ranging from personal to domestic to workplace and public safety. So that's quite a bit of work that we're doing. Recent times, we've been very active within particular sectors, specifically focused on construction, schools, oil and gas, and manufacturing. However, due to the recent and ongoing pandemic, which has caused massive disruption, we've found out that we have not been insulated. As we speak, we've got roughly about 1,337 cases. As such, we've reached the stages of community transformation. What do we do? Considering this, the way we live, work, play has changed, and that will stay for some time to come. Our commission, recently working with SAIF, the Safety Advocates Empowerment Foundation, we carried out some surveys, and I'll share a few slides of what the findings are. We asked people about the use of nose masks after the lockdown, during the lockdown and also after the lockdown, post-COVID. And it's quite interesting to see that 89% of respondents said that they would wear masks. We had 7% saying they will not wear. The next slide again shows how people would go ahead in terms of greeting and exchanging pleasantries in the society. 75% roughly said they would wave hands, so people would not shake anymore. Less than 5% said that they will still go ahead with handshakes, which leads us to a complete change in the workplace. We all know that shaking hands has traditionally been the way of sealing business transactions. They signify trust. You don't end a meeting without shaking hands, particularly if it's a business dealing. But again, life has changed. We need to change with it. It's quite interesting looking at some of the feedback that we've got from the respondents and some of the things that they are saying that they would stop doing or they will start doing going forward. Again, we asked about questions about personal hygiene. What do they think about cleanliness and hygiene? And 92% of people said that they believe that people will become cleaner, people will pay more attention to their health, people will pay more attention to their hygiene, people will pay more attention to their safety and security, while 4% said otherwise. Again, this means that as occupational safety and health professionals, we need to stay one step ahead of the game. If a lot more people are deciding to be more conscious, then we need to up our game. We need to research more. We need to be able to give them and provide answers to a lot of the questions that they will be asking. Some of the things we've been thinking about as a government is creating disinfectant tents across public places and workplaces in Lagos State and seeing how practicable this could be. And again, the feedback that we got was quite interesting. 81% of people are saying that it's possible, it's practicable, and that they would feel safe going through these disinfectant tents before they get into public spaces, places such as cinemas, nightclubs, banking halls, food joints, wherever is termed as a public place. They feel that if it's regulated, then they will go through these tents. This next slide shows how life has changed in terms of impacted people the most during COVID-19. And some of the stats that jumped at us was quite interesting. We all know that it's affected most people economically. It's had a bottom line effect on their pockets. But one of the things that jumped at us was the mental. That 10% of people gave feedback as regards their mental health. And this is interesting to note, because aside what's going on right now, you've got the slight fever, you've got the slight cough, you've got a sore throat. The first thing that comes to your mind is, oh my God, my mind's playing tricks on me. Have I got COVID-19? And then you start to watch, there's a lot of anxiety. And the questions then will be, how do we support people in the workplace going forward? We'll probably get a lot more people calling in sick, a lot more people that will start to show anxiety symptoms at work, at the workplace. How do we deal with these as occupational safety and health professionals? These are some of the things that we will need to quickly start to deal with once we start to ease the restrictions and the lockdown. Again, a number of people were very concerned about their ability to move around. Roughly 20% of people said that this has affected them. But again, going forward, we will then start to have issues with transportation. How do we ensure that people travel from their homes to their workplaces safely and come back home safely? How do we ensure that rideshare companies like Uber, Bolt, Taxify are ensuring that they're in line with best practice in terms of all the requirements that are required post-COVID? So what we're doing as the Commission is we're writing guidelines across all the different sectors, from food to transportation, to education, to workplaces, private and public. And these guidelines will then state very, very basic things that people need to take into consideration. Moving forward to the next slide, again, generally people think that the SMEs and the artisans and the tradesmen, the Mr. Joe blogs are the ones that have been impacted and affected the most by this pandemic. Roughly 45% of people feel that they've been the ones that have been severely hit, because again, they live on a day-to-day basis. It's what they kill today that they eat tomorrow. And a lot of them operate within the unstructured market. A lot of them are not captured in terms of the social database, and a lot of them are unknowns. So as occupational safety and health professionals, and also as safety regulators, we need to start thinking of how do we ensure that these people also practice a lot of the social distancing measures, a lot of the hygiene measures that the more structured companies or organizations will probably fall into immediately. We need to think of a way where we can reach them, where they can give us feedback. And some of the things that we're also doing is we're currently developing technologies where people can easily get across to us on their mobile phones. We realize that most people have a mobile phone, and a lot of people have a smartphone. So we're developing very basic, very easy to use technologies where people can ask questions if they're not sure, particularly focused within the SMEs, the artisans, and the tradesmen. Another major sector that clearly came out was the transportation, which I've discussed earlier. People are concerned about how they're going to move around from place A to place B, particularly if they're going to have to go through public transport. Again, we're working on guidance with regards to this. And again, because we operate in a particular a country or situation where our public transport is not very structured, we've got the motorways. A lot of questions are going on around how do you maintain social distancing within a motorway? How do you do this? How do you do that? Again, that's the task we have. We've been working with a lot of safety practitioners. We've been working with a lot of thinkers, strategic thinkers, and coming up with a robust policy that would guide all sectors across Lagos State. One of the areas that people are concerned about is also education, where parents, children are at home. And if you start to ease the restrictions and people start to move back to their workplaces, what then happens to the children that are at home? If the schools can't open, then how do you manage them at home? Again, it's a challenge. It's part of the things that we need to think about. And the more we think about these things, the more we get some of the opportunities pop by. Some we fine tune them, others we consult even deeper to seeing how we can carry the forgotten majority as a whole along. Part of what the state government is doing with regards to education is a lot of online classes, a lot of TV and radio classes. But we know that this is it's not exactly the same thing as being in the school compound, because again, we understand the limitations, particularly with people that go to public schools, the fact that they don't have laptops that they can use for smart learning. So what would the new workplace look like? And this is just a tip of some of the guidelines that we will be putting in place. Like I earlier mentioned, the no handshake policy. This has to be a must for now and going forward for some time to come. From the reports, from the results of the survey that we got, roughly about 90% of people have already said that they're not going to be shaking hands. So I don't think it would feel bad if you don't want to shake hands with your next person. A lot of people have been saying rather than shake hands, they can swing their legs, just to show some form of physical contact. But this is something that we will definitely be enforcing going forward. And also talking about enforcement, there has to be more hand washing and usage of hand sanitizers. We will urge and employ organizations to buy more of these. We'll also urge people personally to buy theirs and always use them anytime you can't get the chance to wash your hands. But with certain sectors like the manufacturing or the food processing sectors, where you tend to do a lot more with your hands, we will be instituting a strict regime where people have to leave everything they're doing and go and wash their hands, sanitize their hands before they get back to work. Again, in terms of mental illness and physical illness, a lot more people would have to stay at home if they're sick. We operate in an environment where people, permit me for the use of this word, people carry sickness with them everywhere they go. I've had situations where people will have the typical malaria fever that we have here, and they will say, I've had this fever for a month. And even with the fever, the man still comes to the office. He's got his anti-malaria tablets that he keeps popping every other hour. All this has to stop. You're not well, you have to stay home. And the message also has to go to the managers and the owners of the organizations that it's in their best interest to keep the man at home, and not only keep him at home, also report any incident where anyone is not feeling well or is sick. Part of what we're also going to be doing in terms of our sensitization and advocacy is getting people to stagger their staff and get as many people to work from home, because this then reduces the demand on public transportation. It reduces the demand on numbers of people that are physically present within a confined space. And also talking about confined spaces, we would prefer if people, organizations could consider opening windows from time to time to let's let the stale air go out and get some fresh air in. Should peradventure someone that has been exposed to the COVID-19 virus has probably gone through that confined space, some of the microbes will be let out once the windows are open. So some of these are the things that we'll continue to do on a constant basis. Disinfecting is a big issue. Spoke earlier about the disinfectant tents, but beyond that, there will have to be regimes of regular disinfecting of touched surfaces. Again, we will be doing a lot of campaign about people not touching surfaces, not touching door handles. You want to open the door, try and use your elbow if possible, and also reduce the exposure in terms of business travel, because this then again ensures that whatever you have or you might have with organization, people in the organization might have is localized to that local environment, and people are not spreading around, moving from Lagos to Abuja to Kano. And beyond this, this also reduces the carbon emissions and reduces it helps us in terms of the environment as a whole. One of the things we've noticed recently, due to the measurements in terms of the carbon emission measurements we've been taking during this lockdown period, we've realized that the air is clearer, it's cleaner, and the environment is so much better. So it's a pointer that a lot of vehicles, a lot of factories, all these emissions are part of the problems that the world has in terms of cleaner air, in terms of problems with the environment. And some of these problems then go into health issues for people that are asthmatic, people that have respiratory underlying issues. Again, we need to think very carefully about how we bring food to the office and how we handle and share food in the workplace. It's part of the guidelines that we're looking at, particularly with large organizations such as the manufacturing companies that have thousands of people coming at the same time. They need to have their lunch breaks. They need, some of them work a 24-hour shift, so they do breakfast, they do lunch. We need to think about how do we ensure that we handle and store the food appropriately. With regards to large meetings and events, this is a no-no, absolutely a no-no. And this is going to be a no-no for a very long time to come. And the beauty of applications such as Zoom and so many others, we'll start to see a lot of local ones being developed as well, and a lot more people will start to use them. Yeah, the very obvious one is the social distancing. Again, it could be a bit difficult to observe social distancing in its entirety. We preach 2 meters, but in the event that you can absolutely not do 2 meters, make sure you don't do anything less than 1 meter. With the use of wearing masks, if you need to sneeze, at least, again, you won't sneeze out completely. We're running a campaign right now called Mask Up Lagos, and the campaign basically has to do with the use of masks. As the earlier speaker mentioned, there's so many things that go around the use of masks. What type of mask are you wearing? Could it be that you could be contaminating or infecting yourself or other people with the use of mask? How do you dispose of this mask? How do you clean them? And so many issues around the use of masks. So there will be a huge campaign. We've already started, but there will be a lot more with regards to the use of masks. And also the masks have to be appropriate, not the N95s or the surgical masks that we see a lot more people use. We prefer that they keep these N95s for health workers or people that are in the front line, that are keeping the rest of the citizenry safe. So with regards to masks, there's a whole lot of work that we'll be doing, again, with some of our consultants. A lot of the occupational safety and health workers and professionals have also reached out to us, giving us ideas as to how we can implement a proper mask up campaign within the state. Beyond that, we also envisage enhanced physical scanning. We will request that, particularly with the bigger companies, we'll request that temperature checks are carried out as often as possible. You come in, you do your temperature check, you go out for lunch, you're coming back into the office, you do your temperature check. I mean, these things are ways where we can quickly identify and isolate any possible cases of a high fever, which is one of the symptoms of this virus. And then again, obviously, which we've been mentioning, it's one of the categories of safety compliance, which is personal protective equipment. For example, people within the construction sector, they're highly exposed, very unstructured environments. People go in, people go out easily. So we would go harder with enforcing personal protective equipment. So at least you're protecting yourself and you're not having to have injuries or diseases by lack of not wearing these PPEs. And by doing this, you're reducing the pressure on the hospitals so that we can free the hospitals for people that really need them, people that have caught the virus. One of the things we would, again, start to rigorously do is read a reporting of injuries, diseases, and dangerous occurrences. It's high time, it's about time that we would get the database of all organizations working within Lagos State that have more than 5 people to start to give us feedback in terms of injuries, feedback in terms of illnesses, feedback in terms of anomalies, near misses, God forbid, fatalities. Because what then happens is that we start to get the data, and with this data, we can then even start to project and then start to manage. And this then leads us to what we've started work on automation. We're currently in the process. We're testing some of our automation applications and compliance management systems right now, such that again, people don't necessarily need to come into our office or other branches to come and give us the reports. From their laptops or from their mobile phones, they can send us this report. And part of the communication—
Mr. Larry, you've got just 2 minutes more.
Okay,
Sorry.
I'll be rounding up.
Thank
and
you.
Part of the communication that we'll be sending out basically will be that even a no report is a report. Beyond this, we'll need dedicated HSC officers to be able to, they will be the point of contact for these organizations. And for companies that don't have HSC officers, they'll need to nominate someone that can liaise directly with us. Beyond everything that I've said, I think one of the things that is very key and important is the management commitment. Now is not the time to try and save money. Now is the time to save lives. So we're asking, we'll be pleading, we'll be doing a lot of advocacy, we'll be doing a lot of meetings with top management, staff of organizations to let them buy into this message. If we work together, we can stop this COVID. Thank you very much for listening.
Thank you, DJ Lagos State Commission, Mr. Larry. We'll quickly go into some questions now. We'll take some questions. It's now an opportunity for members to ask questions. If you have any questions you need to send, please make sure you make use of the Q&A section beneath your screen. I'll quickly take the first question. Another one, Dr. Ivan, if you can take this. COVID-19 has underscored the importance of health of workers. Is there any program the WHO or ILO can put together to ensure that health workers are properly trained and remunerated? Do you want to take that, Dr. Ivan? Dr. Ivan, do you want to take that? Okay, I'll take that again. COVID-19 has underscored the importance of health workers. Is there any program the WHO or ILO can put together to ensure that health workers are properly trained and remunerated? Dr. Ivan, would you like to take that?
It looks as if Dr. Ivan has had to leave due to time. So we've got Lanre and we've got Buzola still with us. Okay,
I'll ask Larry to take that. Larry, to collate out to the Safety Commission. Is there any program the ILO or Safety Commission can put together to ensure that the health of workers?
Can you hear me?
Yeah, I can hear you.
Okay, so the Safety Commission, ever since this pandemic broke out, we've been working closely with the Ministry of Health. And the Ministry of Health have taken the lead with regards the response to the pandemic. And there's so many teams in terms of collaboration, in terms of training for health workers, in terms of PPE use that are currently being done. And again, they will just continue to reiterate the importance of more of these coming up. As we speak, we've not had any direct program with the ILOs, but again, it's something we can look at. And obviously we're looking at, like I said earlier, collaboration is the word right now. We're looking to collaborate with as many organizations as possible.
Okay, thank you, Mr. Larry. I think there are a lot of questions. Like we've got about 57 questions. We'll try to take as many as we can for the next 15 minutes. What immediate plans do organizations have to partner with government in setting up COVID-19 testing centers? I think, Larry, that seems to be more directed to you.
Okay, so just before I came on the webinar, I was reading about the NCDC approving 2 more testing centers within Ogun State and Lagos State. As things are right now, Lagos State has a number of testing centers across a number of local governments within specific schools. we can share you the details exactly, the exact details with you after this presentation. But there are quite a number of places where you can go to get tested. But again, you don't want to go and get tested if you don't have any of the symptoms. You need to have some, because these tests are limited, and we need more for people that are actually showing signs of the symptoms.
Okay, thank you, Mr. Larry. This question is from Olubusola. I think I'll direct this to Ms. Busola Alofe. As the only recognized HR body in Nigeria, how will you ensure that HR directors adhere to the resumption cautionary measures?
That's a good question. So first of all, it's very, very important for every individual to have a sense of personal responsibility with regards to making sure that they stay safe as individuals, protect themselves, adhere to the safety measures, the safety precautions, and that they also demand the same from everyone around them. So that's taking us into the space of personal accountability. That's number one. Number two is integrity as a leader. Leaders have to remember that this is about everybody else. And the minute one person is exposed and infected, that person becomes, in quotes, a ticking time bomb that could create a lot of havoc and do a lot of damage to other people around. So this is a very serious responsibility that HR directors must pay attention to, and they are. Specifically to the question, we have all sorts of platforms via which HR directors collaborate, have discussions. There are ways to engage, there are ways to follow up and see how each person is addressing return to work in their respective organizations. Second of all, there are surveys that can be done of employees in different organizations to get a pulse and a feel for what they are experiencing in terms of how well they are being protected in terms of their safety, in terms of health in the workplace. So these are different measures that the CIPM can actually put in place and channels for getting data and insights that can then be fed back to the HR directors to help improve. So we're all in this together, and we're just going to have to continue partnering to address this.
Thank you, Busola. So this other question from David. Larry, would you like to take this? What is the Safety Commission role in ensuring public safety in mobility and in the transport sector to ensure that people are not overcrowded during post-lockdown?
Can you say that again, please?
The question is, what is the plan of the Legal Safety Commission to ensure that transportation sector is actually taken care of to reduce cluster of people during transportation once the lockdown has been opened up?
Okay, so with the transportation sector, it's quite unique, particularly knowing the states where we are in. A lot of people rely on public transport, the BRT buses, as well as the BRT buses, as well as the downforce. And part of what we've been doing immediately they started was engaging with the NURTW, engaging with the Ministry of Transport in terms of specific collaborations within the transport sector. There will be a lot more enforcement. We will certainly have safety marshals deployed to transport parks. Part of what we're also doing is also leveraging on some of the resources we have. We've reached out to the NYSC to see how we can use them as well and deploy them across the state in terms of being safety ambassadors, ensuring social distancing, ensuring that people wash their hands before they go into the buses, and ensuring that temperature checks are done. So these are some very, very practical tips that we'll be deploying. But beyond the practical tips, again, in terms of the management of this, we've already spoken to a lot of the associations where the drivers belong to, in terms of training them as to what to do in the event that there's an emergency, or in the event that they notice anyone that has potentially a symptom that is associated with COVID.
I can take this. As we prefer to resume work next week, Monday, amid curfew from 8 p.m. to 6 a.m., is it advisable for all workforce to resume same day, considering peculiarity of Lagos traffic? Busola, would you like to respond to that, please?
My guidance to everyone would be, and particularly the leaders in organizations, because this is new to us. We are restarting, reopening, for the first time largely as a nation. My advice is we take it slowly. And so, as I shared, it's important to kind of figure out which jobs must be in the office on day one and which ones can still continue to work from home. Once we do that and we kind of figure out, okay, based on social distancing requirements to keep ourselves about 2 meters apart, how many people should be in any one space at the same time? In fact, I really don't even think that physical resumption should happen on Monday the 4th, because it's important to actually go back into the offices and space it out. Figure out, what physical adjustments in terms of desk arrangements, in terms of, all of that need to be made before we actually allow people to start coming into the office. So I believe that Monday is when we move into the pre-planning phase. And after that, then we start to worry about people moving from home to work and back home and making sure that that happens safely. So week one, at least, figure out the physical spaces in the office locations. If you have 10 tables in a room, then you got to reduce that to 5 and make sure it's only the really, really essential people that can't really work from home at this time that are back in the office early, and gradually we can start increasing those numbers as we see what's going on, how it's working, and how safe people are.
Okay, thank you, Busola, for the response. I think that we'll also quickly need to take this. We're running out of time. At this present situation, is it advisable? We expected a lot of workers to be laid off. What is CIPM doing to ensure that the rights of workers are protected? Busola, would you like to respond to that?
That is a very, very hot topic. And the responses people are expecting, from, why can't CIPM, kind of give us palliative packages like, maybe a number of other companies have actually done. The truth is, the CIPM itself is an organization that is impacted. So in terms of cash flow revenues and things like that, at the moment, we are actually revising our business plans and projections for the year, like every other organization is doing. Notwithstanding, there are very creative things that we can do. So as we speak, we have requests for proposals out with about 9 insurance firms, and we are asking them to partner with us in putting in place insurance packages for workers, going into job loss protection, life insurance, and so on and so forth. And this is part of the packages that we want to make available to our workers. There are other creative things in terms of how we can support one another at an individual level. So for example, not that we've started this, but there's so many ideas. I mean, how much would it cost to put food on the table of one person in a month? If one person is able to support one other person, then we can help the government with its the measures it's putting in place to implement palliative measures to reduce the suffering of people, especially as people are losing jobs, which is happening particularly in the smaller companies. And then going even into layoffs, laying people off does not necessarily have to be the immediate action that organizations take. There's so many other things that one can do step by step while we are seeing how the economy is improving as the lockdown gets removed. So, there have been a lot of conversations. I'm not going to repeat all that here, but watch out for the articles. There are a number of them floating around in terms of how to support workers both during and post the lockdown. And quite a number of those are also coming from the CIPM, in addition to specific webinars that are addressing the topic.
Thank you, Busola. We might not be able to take additional questions because of time. I would like to just end this session by thanking our presenters and all of you who have joined us today for this webinar. We'll be making a link to the recording online and via email. So please look out for it in your inbox. Thank you for joining and for taking part in this session, and do take care.